Hi, it's me again. This is our video standing up. I've got the mirror in front of me, so we're going to be doing a little bit of acupressure work for trigeminal neuralgia. And as I said in the other video, this is because my amazing mom is working with trigeminal neuralgia, and anyone who is working with that knows that there's a lot of pain. With my mother, it's up here in this hemisphere, up in her upper left side. So wherever the trigger point is for you, don't put direct pressure on there. But we're going to walk through how to do this standing up with a mirror in front of you. And if you see me looking off, I'm looking up into the mirror so that I can show you, so that you can watch yourself. This is a good way to practice for a couple times, maybe before you do it lying down, but lying down is so much more relaxing. And for people who haven't seen the video of me laying down going through this, my mother has had trigeminal neuralgia for a few years, and it was really painful. We did these maneuvers once a day for a week, along with taking a nervine. Nervines are a type of plant tincture medicine. It's plant medicine tincture, that an herbal medicine that relaxes your whole system. So as anyone knows that has trigeminal, is working with trigeminal neuralgia, it has to do with your whole nervous system being kind of turned on. And the medical community doesn't know a ton about it. There's a surgical procedure that is a little bit daunting. Someone my mother's age, it's not an option. So anyway, this worked for her, and I wanted to share it with everybody. So along with doing this once a day and taking that tincture just to relax her whole nervous system, seemed to have calmed it down, and it went completely away actually for a number of months, and now it's back. So we're trying to do this so she can do it herself. So the first one is just, we're going to walk through this, and as I said in the first video, I'm going to talk. You're not going to be talking, you're just going to be concentrating on breathing, tummy breathing, and just relaxing and doing those visualizations of the golden light coming in through the top of your head, and just relaxing and easing the pain and letting it go out through your feet into the earth. Again, this is not a really strong pushing. None of this is intense pressure. Just gentle, and you'll know for you what that is and when it feels good. So you've got your thumb right there, just the flat of your thumb. You're not digging in with any of these. You might want to push to one side. There's another nerve that runs along here. We're not going to get into all the big words for all these things. I'm just going to show you through these exercises that worked for her. Well, they're really acupressure movements. And then you go to the other side. Just feel what feels right for you that day, what relieves any pressure. Again, breathing. Take as long as you like. And then the next maneuver is when you're going to take your hand and you're going to go, you're going to just go ahead and push. Instead of pulling down a little bit, you're pushing on a little right here on your lip. And you're just relaxing your hand there. You can put your other hand here, and like you did laying down, you can massage these occipital muscles with your thumb a little bit. Just don't activate any areas, just holding and breathing. And you stay there as long as you want. A couple of minutes is good. Then, as with everything else, you're going to do the exact same thing on the opposite side. Just you're going to push here, and you can take you can push, sorry, it gets turned around with my hands. But you can pull this way too, so you can do it this way. And then just again, you're massaging gently with your hand, or just holding your hand there, or you can just put your hand down. And breathing. This is sending signals to your nervous system. One of the things it's doing is just to let go. You're working with your whole system here to just release. Good. And then you want to be able to do this maneuver here where you're actually with your thumbs and your nose. It's pretty easy to do standing up too. Again, it's pressure under your nose. Right here, you'll feel this sort of groove where your cheekbones come up, and you're just gently, again, you have your hands on the side of your head, just gently, and you're just pushing in and up, just gently, not too hard, just so it feels good, like relieving and breathing. And again, make sure you stay in these positions for a minute or two. You'll get to know your body. And when the pain starts to ease and your body's starting to relax, you'll know. Usually it takes at least a minute. And then you let go of that one, and you want to, at this point, you want to be doing something with here, just like you did with your chin. So you're going to be pushing this way with underneath your nose. So you're just going to push that way, and you're going to hold it. You can just put your thumb behind your ear. You can massage a little bit with your thumb, or you can take your other hand and massage your neck, or just hold your hand there, or drop your hand down, but you're just using to push your lip gently to the other side for a minute or two. It's really just underneath your nose. You're just going right underneath your nose, right here, but I like using a couple fingers like this. It feels better. Breathing, and again, you're gonna do the same thing on the other side. Pushing gently to the other side and massaging if you want to behind your ear. It's kind of hard to do that though, so maybe if you want to massage with the other hand, just kind of gently relax your neck. Breathing, just pushing gently. And again, if anything gets activated, which it can, like I shared in the other video with my mom for the first week, the first couple days, it was weird for her body to have these maneuvers, so it activated her area up in her upper left. So if that happens, just immediately let go and put your hands, again, not pressing here, but you're pushing mainly with your palms of your hands. It's kind of like you're in a little bit of a vice on both sides of your head, and you're just pushing in. Just gently, not too hard, and you just stay there until it deactivates. Just keep breathing. And imagine that golden light coming in through the top of your head and coming in and relieving that pain and going out through your feet. Good. And then I like to, one of the second to last maneuvers I like is this eye maneuver. Just going up with, again, the flats of your fingers, and you're just pushing really gently on the top of your eye socket area. And you're just breathing. The eyes can often be involved with the trigeminal neuralgia, and it's, as any of you know, it can be very uncomfortable. So it's nice to give your eyes just a bit of a relief here. At the end, just bring it down and maybe gently massage your temples if you're not activated there for a minute. Feels nice. Keep breathing. Imagining all the cells in your body going to the areas where you have pain and relieving it. You might want to go to your ears. Your ears are an incredible area that have over 100 bones in it, tiny little bones that sometimes get out of place. So it's nice to just do really gentle pulling and releasing and massaging for a minute. Some people don't like their ears to be touched, so that's fine too. Yeah, feels good. And then The very last thing to do that's just really relaxing is if you have a favorite essential oil. You could have done this in the beginning actually too. You put a drop of it in your hand, but if not, do it now and rub it together really hard. Make it really, really warm. Really warm, really warm, really warm, and just put it over your face. Nice deep breaths. Good job. So you can stay there too for a minute or two. And remember to stick with this. It's not something, again, with my mother, everyone's going to be different. It worked well combining the Nervine with this work for a week, and then it completely went away. So we'll see if she can do this herself, and hopefully this will help many, many people out there.